feet are something we usually don't think much about. Of course, we're thinking about them right now, and then they start to hurt, and that's all we can think about. After all, the average adult walks 100,000 steps in a lifetime, and 75% of us complain about foot pain at some point in our life. Dr. Louis Giannone from the Gulf Coast Medical Group is here to talk about foot issues. Oh, do we need you, doctor?
Thank you.
Thank you for coming.
My
what
pleasure.
are the major issues besides just having 8 toes, like Mrs.
Yeah,
Bush?
8 toes. Major issues, the most common complaint that people come to the office with is for pain. Pain is
I
the
have
most
been
common
there
thing.
myself. I know that.
Yeah.
I was amazed because there was really something that the podiatrist could do about it.
Sure. There's a lot of things that we can do. I mean, it depends on what's causing your pain. It can be anywhere from overuse injuries, arthritic conditions. I see a lot of diabetic patients that develop pain really for no reason except that their nerves are not functioning properly. It's called neuropathy, and that leads to a lot of other problems.
I know this isn't on your list, but you know, to answer the question everyone's thinking, can your toe really just disappear?
Your toe cannot just disappear.
Okay, thank you. We're all really worried.
Yeah. That's not for lack of sleep, like her granddaughter told her, but it can happen. And the second toe is very common with Mrs. Bush if there's poor circulation.
So is it more like amputation or something like
Amputation.
that? So not
They don't just disappear. Okay,
Yeah, more
good.
commonly people are born with extra digits than,
than not having enough.
That'd be a problem with
But
shoes.
you can have it.
But if you have foot pain, it affects all of your health,
Sure.
doesn't it?
Sure. Well, I mean, I think our primary role as foot specialists and podiatrists is to keep our patients ambulatory. Inactivity is probably the best, the greatest contributor for what we see today with the diabetes and obesity epidemic.
Oh no. Okay.
So if you're able to keep people walking and moving, you're helping their entire being and longevity. Again, going back to, I see a lot of diabetic patients, and in those patients, for lack of sensation and lack of circulation, they develop wounds on their feet, which inhibit them from walking, cause bone infections, and there's been statistics shown that having a sore on your foot is ranked up there with like colon cancer for mortality.
Oh
Wow.
my goodness.
Yeah, so keeping people walking is super important for the entire, health.
What are you looking for when you assess foot pain when
Sure.
somebody comes to you?
Sure, every patient gets a full eval. You're first checking the skin, obviously, for any open wounds, sores, rashes, new growths. Here in Florida, melanoma is a big problem from the sun.
Even on your feet.
Oh,
yeah,
my.
yeah.
I guess I don't put sunblock there, so
it's
that's a problem.
It's a very rare place to develop melanoma, but it happens. I mean, I've had patients that have been treated for what they thought was an ingrown toenail for months and months, and it's
Wow.
Oh,
very
wow.
bad malignant melanoma.
Speaking of ingrown toenails, when you have heels, it always causes that. Are heels just as bad as people say they are?
Heels, more
6-inch heels.
Yeah, more than
Yes.
up to an
Have
inch
one
is
right
usually
now.
okay, but when you get more than an inch, and I think with your question for the ingrown toenails, it's more the point at the front of the shoe.
So heels are
crowded.
hard and pointy heels are
Yeah,
worse.
well, heels are going to distribute your weight more anteriorly to the front part of your foot, causing pressure. That's where a lot of people that wear high heels, they complain of pain under their forefoot, under their ball of their foot, because of the weight
That's where I have
distribution.
it. Yeah, so
and then the narrow will cause the nails to ingrow.
how do you assess the treatment that you're going to use when you're seeing patients?
It really depends on what they have. Going back to like an initial eval on a patient, they're going to get skin checked, circulation checked, make sure their pulses are palpable and strong and regular, that their capillary return, that they pink right back immediately. And then we do a couple rudimentary neurological tests: vibratory sensation, protective sensation, position sense, and then the orthopedic exam of do they have foot deformities that could contribute to pain and eventual problems, bunions, hammer toes, different type of bone spurs.
But not always surgery. You've mentioned injections often work.
Oh, it
Yeah.
worked perfectly for
Yeah.
me. I went from agony to no pain at all.
Surgery is a last resort. You know, that's when you've exhausted conservative care.
But you can fix it in most cases.
I do my best to fix everything.
Unless you're trying to grow an extra toe.
Right.
You're stuck with those 8 toes if that's what you've got. Thank you so
My
much,
pleasure.
Doctor.
Thanks for having me.
And for more information, go to Gulf Coast Medical Group, gulfcoastmedicalgroup.net, and get more information. You don't have to have sore feet. And next, a performance by Twinkle. We can hardly wait.
Oh,